Hello everyone, welcome to our leadership group project on myocardial infarction and care. This will be presented by Melissa Reynolds, Morgan Schroeder, Taylor Simpson, and Veronica Ziola through the Mount San Jacinto College School of Nursing.
Objectives for this project are as follows. At the conclusion of this presentation, participants will be able to summarize statistics surrounding myocardial infarction, recall a minimum of 3 causes and risk factors leading to myocardial infarction, describe signs and symptoms indicating the presence of myocardial infarction, differentiate between the different diagnostic measures used to identify myocardial infarction, state treatment and prevention measures for myocardial infarction, and identify appropriate discharge instructions for patients.
In the United States, nearly 1.5 million individuals are affected annually by myocardial infarction or stroke. Thus, this cardiac occurrence has been experienced or will be experienced by a large part of the American population. While comprehensive therapy for this physiological problem is available, the mortality rate is considerably high. 12% of myocardial infarction patients die from it, according to the Center for Disease Control and Prevention. Given that heart disease is so prominent in the American population, the overall mortality rate and economic cost are a considerable threat to the American population. An accumulation of 114 studies have shown that the total cost of hospitalizations for acute myocardial infarction are $11,644, which is a notable economic burden for those who are diagnosed. For the 1.5 million patients who are diagnosed with myocardial infarction annually, this disease process is a strenuous burden both financially and physically. Thus, having thorough knowledge of this event, along with the care and most importantly, how to avoid it, is a crucial knowledge for nurses to know.
Functions of the heart. The heart has 4 chambers, the left and right atria, and the left and right ventricles. The heart basically functions to pump oxygenated blood to the organs and the systemic tissues. It removes carbon dioxide and waste and supplies the tissues with nutrients. The heart is at the center of the circulatory system with a vast number of veins and arteries attaching to it in order to supply these tissues with blood and oxygen and nutrients. It's a muscle that separates into 2 sides, and the entire body relies on the proper function of this muscle, basically to keep the body going. This muscle basically has a flow chart for blood. So the right side of the heart receives deoxygenated blood via the superior and inferior vena cava into the right atrium. The right atrium fills and pumps blood into the right ventricle via a valve known as the tricuspid valve. Once the ventricles have filled and they exceed the pressure within the pulmonary artery, the ventricle will pump the blood into the pulmonary artery through a valve known as the pulmonary valve. As the blood travels through the pulmonary artery, it's carried to the lungs where the alveoli are at the capillary membrane, so the blood in the alveoli will exchange oxygen and carbon dioxide. The vessels will take the oxygen in, and the lungs will take the carbon dioxide out. After they have exchanged the blood and the carbon dioxide, the veins empty the oxygenated blood into the left atria. The left atria fills completely and will pump oxygenated blood into the left ventricle via the bicuspid or the mitral valve. As the left ventricle fills and exceeds the pressure within the aorta, the left ventricle will pump and the blood will go into the aorta via the aortic valve. The aorta will then carry the oxygenated blood away from the heart to systemic circulation to oxygenate and deliver nutrients to all other organs and tissues. What is a myocardial infarction? A myocardial infarction, or what we call an MI, is an abrupt interruption of oxygen supply to the heart. This can be caused by plaque emboli, aggregated platelets, so a blood clot, vasospasm, hypertension. All of these lead to ischemia, and we know ischemia is like the block of oxygen to the tissues, and then after ischemia, it can cause necrosis of the myocardium, which is actual like death of the tissue. An MI is basically classified as a STEMI versus a non-STEMI, and we know that a STEMI is a heart attack that causes ST elevation on 2 leads of the EKG 12 lead. You have to see it in at least 2 leads. A STEMI is more dangerous than a non-STEMI because once we see this tombstone on the ST segment, we know that there's actual necrosis of tissue. Whereas a non-STEMI, this can show slight alterations in your EKG, but this does not have the tombstone. A non-STEMI basically shows us that there is ischemia, but we don't yet have necrosis. So what are some risk factors for MI? Smoking and tobacco use, because we all know those cause vasoconstriction, hypertension, high cholesterol, so bad diet and having high lipid levels, obesity, poorly controlled diabetes, because we all know that kind of damages our vessels and our nerves as well, and coronary vascular disease. So those are all a little bit connected, and these are our main risk factors for MI. Anytime that we do have an MI, we go through the process of, checking our EKG and checking the symptoms in the patient as well as our labs and diagnostics, and we'll talk about that a little bit later. So let's talk about symptoms of a myocardial infarction. So our biggest symptom is chest pain or discomfort. This discomfort can radiate to the arms, neck, jaw, upper stomach, or back. Shortness of breath, which may be sudden, nausea, breaking into a cold sweat, or lightheadedness. Symptoms vary for MI from person to person. So for every individual, their symptoms are different. Most common symptoms for men are those initial ones we just talked about. So crushing chest pain that radiates to the right arm and into the neck. And women, on the other hand, most commonly have symptoms of like epigastric pain, jaw pain radiating into the back, feelings of fatigue or anxiety. So each individual is different, and once they come into, the ER, or they come into, you see them in public or anything like that, we need to make sure that we're keeping all symptoms in mind.
Laboratory values. There are many labs that are drawn when an MI is suspected. Troponin is a myocardial muscle protein that is released only when necrosis occurs. Troponin levels rise within 3 hours and remain elevated for 7 to 10 days. Because troponin levels rise so quickly, it is the fastest way to indicate an MI. Total creatine kinase rise within 6 hours and peak at 18 hours. Creatine kinase myocardial band enzymes is known as the golden standard for diagnosing a myocardial infarction. The CKMB peaks at 18 hours after the onset of chest pain and will return to normal after 48 to 72 hours. Myoglobin levels will begin to rise 2 hours after cell death and last for 7 hours. White blood cells become elevated following the second day of an MI and stay elevated up to a week. Diagnosis. The initial area of infarction is known as the zone of necrosis. Abnormal Q waves can be found on an EKG indicating the dead tissue. After the zone of necrosis is the zone of injury, in which there is ST elevations found on the EKG. The zone of ischemia is then found outside of the zone of injury and is indicated by T-wave depression. There are two types of MIs, ST elevation, known as STEMI, and non-ST segment elevation, which is known as a non-STEMI. Patients presenting with a STEMI have ST elevation and two leads together on a 12-lead EKG. The ST elevation indicates myocardial necrosis. Non-STEMI usually has ST and T-wave changes that can be seen on a 12-lead EKG. The combination of an EKG changes and elevated troponin levels are indications of necrosis. However, these should always be assessed along with the history and how the patient is presenting their symptoms. Electrocardiogram can show a STEMI and a non-STEMI, T-wave inversions, or abnormal Q waves. Diagnostic tests following the acute phase include a stress test to evaluate ischemia and medical therapy needed. Thallium scan to assess necrotic tissue in the cardiac muscles, or multigated cardiac blood pool imaging scan to evaluate left ventricle function, and cardiac catheterization to determine the obstructions of the coronary arteries. Treatments include both drug therapies and medical procedures. Drug therapy should be given first, since it is the least invasive intervention. Pain medication, such as morphine, can help the patient with chest pain and reduce the workload on the heart by lowering the blood pressure and heart rate. Nitroglycerin helps relieve chest pain or angina by widening the blood vessels to improve blood flow to the heart. Antiplatelets, such as aspirin and anticoagulants, reduce blood clotting. Beta blockers decreases the heart rate and lowers blood pressure by suppressing renin activity. Thrombolytic therapy, such as Activase, dissolves thrombi in the coronary arteries and restores blood flow in the heart. Thrombolytic agents are most effective when given within 6 hours of a coronary event. Medical procedures include an angioplasty, which is an invasive but non-surgical procedure that is performed within 90 minutes of an acute MI. Coronary artery bypass graft, otherwise known as CABG, is an invasive procedure in which the chest is cut open to expose the coronary arteries. A CABG may be necessary when the arteries are blocked in several areas, or if there is a blockage in the left anterior descending artery, and an angioplasty is not the best treatment for the patient.
According to the American Heart Association, there are several important teaching points which should be communicated by the nurse to the patient before being discharged post-myocardial infarction. The first thing the nurse should teach the patient is the importance of scheduling a follow-up appointment with their cardiologist. This is a critical aspect of the recovery process post-MI, as follow-up treatment helps the patient to regain their cardiac health. Evaluation of the cardiac system is vitally important to ensure the patient is functioning adequately. Next, the most effective way to heal from a myocardial infarction and prevent future cardiac events is by simply implementing lifestyle changes into a patient's daily routine. A patient can significantly lower the risk of getting a second heart attack by simply participating in physical activity, engaging with good nutrition, and evaluating blood pressure and heart rate. Additionally, a teaching point that is vital to communicate is a strict medication regime. This is very important post-MI to follow the medication as prescribed, and the patient should promptly report any side effects to their cardiologist. Lastly, an essential action that nurse should include during discharge teaching is providing the patient with local cardiac rehabilitation programs. Rehabilitation services are developed by medical professionals in order to improve health and well-being through education, exercise, and therapy.
NCLEX style question number 1. A woman comes into the emergency department complaining of epigastric pain, which radiates into the jaw and is feeling fatigued. She states, "It's probably nothing. I need to pick up my kids from school." What is the most appropriate response from the nurse at this time? A. Begin the process of discharge and chart the patient denied care. B. Why would you leave the hospital with this pain? It could very well indicate a very serious problem with your heart. C. The problem does not seem to be too serious. I'll see if the doctor can give you a Pepcid prescription before you leave. Or D. Call the physician, educate the patient on why they will need to stay longer, and explain common symptoms of a heart attack amongst females. Pause the video to check your knowledge. The answer is D. Call the physician, educate the patient on why they need to stay longer, and explain the common symptoms found amongst females. NCLEX style question number 2. The nurse is performing educational teaching for a patient who is being discharged post-myocardial infarction. What comment from the patient suggests a misunderstanding of the teaching and will require re-education? A. I will book an appointment with my cardiologist within 1 week of being discharged from the hospital. B. I will go straight to my favorite fast food restaurant after I'm discharged to spend time with my family. C. I will spend 30 minutes walking with my spouse every day per my doctor's recommendation. Or D. I will participate in a cardiac rehabilitation program in order to prevent a second heart attack. Pause the video to check your knowledge. The answer is B. I will go straight to my favorite fast food restaurant after I'm discharged to spend time with my family. That is the incorrect answer and will require re-education. NCLEX style question number 3. A patient complaining of chest pain is admitted to the emergency department. In order to determine if the patient is experiencing an MI, the physician orders a lab panel. What is the most important detail to know about this patient from the lab values below? A. Troponin at 0.4 nanograms per milliliter, hemoglobin at 18.2 grams per deciliter, C. WBCs at 10 billion per liter, or D. RBCs at 4.7 million cells per microliter. Pause the video to check your knowledge. The answer is A. Troponin at 0.4 nanograms per milliliter. That is an abnormal lab value. These next 2 slides show the references that we used for the information from the PowerPoint that you just heard. Thank you for listening.